Further study of worldwide trends and measures and the need of extreme caution during such time as this, I have come to the conclusion that stricter measures are necessary. For this reason, pursuant to my powers as President under the Constitution and Republic Act 11332, I am placing the entire mainland of Luzon under quarantine until April 12, 2020, coinciding with the entire end of the Holy Week.
Our government did this effort today. I am officially declaring a national emergency. Two very big words. The action I am taking will open up access to up to $50 billion of very important and a large amount of money for states and territories and localities in our shared fight against this disease. In furtherance of the order, I'm urging every state to set up emergency operation centers effective immediately.
On COVID-19, yesterday, the bill to revise the Novel Influenza Special Act was enacted yesterday. In case we make a judgment that we are in an emergency based on that act to prevent the spread of COVID-19, to maintain the social functions, various measures can be made by the government. We are facing a national emergency crisis, and going beyond the political standpoint difference, number of infected people is on the wax right now, but we haven't seen the rapid, dramatic increase in the number of infections compared with other nations. Japan is successful to curb the spread of the coronavirus versus other nations.
신속하고 충분히 공고하지 못해 불편을 끼치고 있는 점에 대해 국민들께 매우 송구스럽게 생각합니다. 대구 경북의 위기는 최고조에 달했고 국가 전체가 감염병과의 전쟁에 돌입했습니다.
Our response would evolve too. As the virus continues its spread, we've decided to take increasingly aggressive steps to keep you and your family safe. First, we will be denying entry to Canada to people who are not Canadian citizens or permanent residents. This measure will carve out some designated exceptions, including for air crews, diplomats, immediate family members of Canadian citizens, and, at this time, U.S. citizens. Second, air operators will be formally mandated to prevent all travelers who present symptoms of COVID-19 to board a plane. Air operators will be required to complete a basic health assessment of every air traveler based on guidance from the Public Health Agency of Canada. This means that anyone who has symptoms will not be able to come to Canada. I know this news will spark concern among Canadians traveling abroad. I want to assure you that our government will not leave you unsupported. To help asymptomatic Canadians return home, our government will set up a support program for Canadians who need to get on a plane. Canadian travelers will be able to get financial assistance to help them with the costs of returning home or temporarily covering their basic needs while they wait to come back to Canada. Third, starting Wednesday, March 18th, only 4 Canadian airports will be accepting international flights: Toronto Pearson, Montreal Trudeau, Vancouver International Airport, and Calgary International Airport. At this time, domestic flights, as well as flights coming from the US, Mexico, the Caribbean, and Saint-Pierre-et-Miquelon, will not be affected. The travel restrictions announced today will not apply to commerce or trade. We will continue to ensure the supply of important goods to Canada. I know that these measures are far-reaching. They are exceptional circumstances calling for exceptional measures.
South African citizens returning from high-risk countries will be subjected to testing and self-isolation or quarantine on return to South Africa. travelers from medium-risk countries such as Portugal, Hong Kong, and Singapore will be required to undergo high-intensity screening. Effective immediately, all non-essential travel for all spheres of government outside of the Republic is prohibited. We further discourage all non-essential domestic travel, particularly by air, rail, taxis, and buses. Secondly, it is essential, therefore, that we minimize the risk of the spread of this virus by limiting contact amongst groups of people. While we appreciate the economic, religious, and cultural significance of social and community gatherings, the coronavirus is spread through contact between persons. As we have said before, the current circumstances require extraordinary measures to curb the spread of infections.
My fellow Singaporeans, we have faced the new coronavirus situation for about 2 weeks now. The Ministerial Task Force, advised by DPM Heng Swee Keat, has been leading the government's response to this outbreak. They've been dealing with new developments every day and holding regular press briefings to keep Singaporeans informed every step of the way. Today, I want to speak to you directly to explain where we are and what may lie ahead. We went through SARS 17 years ago, so we are much better prepared to deal with the new virus this time. Practically, we have stockpiled adequate supplies of masks and personal protective equipment, PPE. We have expanded and upgraded our medical facilities, including the new National Center for Infectious Diseases. We have more advanced research capabilities to study the virus. We have more well-trained doctors and nurses to deal with this situation. We are psychologically better prepared too. Singaporeans know what to expect and how to react. Most importantly, having overcome SARS once, we know that we can pull through this too. The new coronavirus is similar to SARS, but with two important differences. First, the new virus is more infectious than SARS. Therefore, it's harder to stop it from spreading. Second, the new virus is much less dangerous than SARS. About 10% of those who caught SARS died. With a new virus, outside of Hubei province, the mortality rate is so far only 0.2%. In comparison, seasonal influenza has a death rate of 0.1%. So in terms of mortality, the new virus is much closer to influenza than SARS. But the situation is still evolving. Every day brings new developments, and we have to respond promptly and dynamically. So far, most of our cases have either been imported from China or can be traced to imported cases. When we discover them, we've isolated the patients, done contact tracing, and quarantined their close contacts. This has contained the spread and helped stamp out several local clusters. But in the last few days, we've seen some cases which cannot be traced to the source of infection. These worried us because it showed that the virus is probably already circulating in our own population. And this is why we raised the DORSCON to orange yesterday and are stepping up measures. We are reducing mingling in schools. We are tightening up access to our hospitals. We are taking extra precautions at large public events.
Buenas tardes, estimados compatriotas. En el día de hoy acabo de comunicar al jefe del Estado la celebración mañana de un Consejo de Ministros extraordinario para decretar el estado de alarma en todo nuestro país, en toda España, durante los próximos 15 días. El estado de alarma es un instrumento de nuestro Estado de Derecho, recogido por nuestra Constitución, para enfrentar crisis tan extraordinarias como la que desgraciadamente está sufriendo el mundo y también nuestro país. La emergencia sanitaria y social generada por el coronavirus, conocido como COVID-19, crea circunstancias extraordinarias como las que la ley contempla para dotar al Gobierno de España de recursos legales también extraordinarios. El Gobierno de España va a proteger a todos los ciudadanos y va a garantizar las condiciones de vida adecuadas para frenar la pandemia con la menor afectación posible.
Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera. Saudara-saudari rakyat Malaysia yang saya hormati sekalian, pada malam ini saya sekali lagi berdiri di hadapan saudara-saudari sekalian untuk memaklumkan status terkini wabak COVID-19 di negara kita. Hari ini saja terdapat 117 kes jangkitan baru yang menjadikan jumlah keseluruhan kes positif COVID-19 sebanyak 790. Ini bukanlah perkembangan yang mengembirakan kita. Langkah-langkah tegas perlu terus diambil untuk membendung wabak ini daripada terus merebak. Kerana itulah kerajaan kita melaksanakan perintah kawalan pergerakan yang mula berkuat kuasa pada hari ini. Saya ingin menjelaskan tujuan kerajaan melaksanakan perintah ini. Kenapa sekolah, universiti dan sebahagian pejabat, premis perniagaan dan kilang ditutup? Tujuannya ialah supaya saudara-saudari tidak perlu bergerak ke sana sini. Saudara-saudari tak perlu bersesak-sesak dalam LRT, MRT ataupun bas untuk ke tempat kerja. Tidak perlu bersesak di kantin ataupun di kedai makan di waktu rehat tengah hari. Anak-anak kita tidak perlu pergi ke sekolah, tidak perlu mengikuti aktiviti-aktiviti sukan dan lain-lain yang boleh mendedahkan mereka kepada jangkitan virus COVID-19 ini. Selama tempoh 2 minggu ini, saudara-saudari dan anak-anak hanya perlu berada di rumah. Just stay at home.
Obviously, this is a global situation. I know people will be reading the news, and some of what you'll be seeing and hearing will be causing people to feel anxious. So I wanted to let you know what we're up to here in New Zealand. Of course, we're paying close attention to what's happening globally, and we're also using the best international advice and medical advice that we have here in New Zealand. But we are ultimately making decisions on behalf of New Zealanders to protect their public health and their well-being. Now, some of those decisions yesterday add to the controls that we've already put in place. Some time ago, we put in border restrictions. So other than New Zealand citizens and permanent residents, those who have been in mainland China in the last 14 days or in Iran are unable to travel to New Zealand. We made additional changes yesterday based on what we're seeing internationally. For those who may be coming into New Zealand from South Korea or Northern Italy, because of the prevalence of cases we're seeing there at the moment, we're asking those travellers to self-isolate for 14 days. Now, self-isolation is a tool that we've been using throughout COVID-19, and in fact is something that we've used in the past for instance, the swine flu. We know that self-isolation works. It's a way to contain people from spreading or perhaps having contact when they don't necessarily know whether they're unwell. What we know from international research and evidence is that people who are asked to self-isolate do. And we know from this occasion that they definitely are. We've had roughly 8,000 people who have been in voluntary self-isolation. We've checked on them via Healthline, and in many cases they are doing more than what we're asking. In fact, I heard from Healthline just a few days ago that some people are staying beyond the 14 days just to be safe. I think that speaks to the way that New Zealanders behave in these kinds of situations, wanting to look out for their community. So self-isolation is a really important part of containment. What's also really important, over and above the border restrictions we already have, is actually people just maintaining good hygiene in the way we ask for other public health issues, like, for instance, flu season. So making sure if you've got a cough, covering your mouth, washing your hands, and if you're unwell, staying at home. That continues to be the advice of the World Health Organization as part of our plans around containment.
First, we must stop the disease spreading to a point where it overwhelms our NHS. And every country in the world has the same problem. This is a disease that is so dangerous and so infectious that without drastic measures to check its progress, it would overwhelm any health system in the world. And I've used the Italian health system. It is excellent. And the problem is not with the health systems, it's the numbers of sufferers. That's why we announced the steps yesterday that we did, advising against all unnecessary contact, steps that are unprecedented since World War II. They will have an effect on the spread of the disease. The shielding of vulnerable groups will also reduce suffering, and I want to thank everybody at this stage for what we're all doing to follow this advice. I stress that although the measures announced are already extreme, we may well have to go further and faster in the coming days to protect lives and the NHS. Secondly, we're doing all we can and as quickly as we can to increase the capacity of the NHS. That means more testing, more beds, more ventilators and more trained staff. It means greater support for NHS and other staff. And it means much better data and much better technology. Third, we must do all we can to boost science and research. We must study this disease, test drugs that already exist and have been through medical trials to see what helps treat severe cases and search for a vaccine. Fourth, we must act like any wartime government and do whatever it takes to support our economy. And that's the main purpose of this press conference this afternoon. We must support millions of businesses and tens of millions of families and individuals through the coming months.
And we now have to escalate our national response. Above all, we must readjust our lives and behaviors, including foregoing certain fixtures, activities and practices we had grown accustomed to in order to keep the pandemic at bay. This holds true at all levels, at personal, community and national level. Today, government deliberated on this looming threat and has decided to take additional measures to ensure that our national response is effective, comprehensive and complete. 1. Government has decided that the coronavirus pandemic be declared a national disaster. This allows government to mobilize resources and take necessary measures in dealing with the pandemic. With immediate effect and for a unified and coordinated effort, I have directed that our national disaster management machinery extend its mandate and focus to dealing with the pandemic, with the Ministry of Health and Child Care as the lead agency. Zimbabweans are discouraged from traveling to, through and from high-risk countries during the same period. Non-essential travel must be avoided or discouraged by all of us. 3. While all our major entry points into the country will remain operational, screening, testing, and other World Health Organization recommended measures will be enforced vigorously. All designated small border crossings will stand closed down from now until further notice. Government has decided to postpone, curtail, or cancel public events, gatherings and activities. In that respect, government has postponed the Zimbabwe International Trade Fair ZITF. All national independence celebrations previously planned and the pending international sporting fixtures until the threat of coronavirus recedes. All these activities will resume as soon as we are satisfied that our nation is no longer at risk. Resources originally earmarked for these events will now be redirected towards strengthening our defenses against the coronavirus and towards drought mitigation. Gatherings of more than 100 people, including those for purposes of worship and weddings, stand suspended for the next 60 days, after which the suspension will be reviewed.
יש אלפי מתים בעולם, באיטליה לצערנו זה עבר כבר את ה-1200, בספרד זה מאות וזה נצבר במהירות. הנשיא טראמפ הכריז על מצב חירום בארצות הברית, הבורסות צונחות, עולות, צונחות עוד פעם, המצב ברור לכם. גם כממשלה וגם אתם האזרחים, המשמעת שאתם מגלים, מכם אותנו במצב טוב יותר מרוב מדינות העולם. בישראל אנחנו מתייחסים לכל האירוע הזה כאירוע מתגלגל, הוא באמת מתגלגל. קודם כל המחלה משתנה, המחלה, אנחנו לומדים עליה כל הזמן, אנחנו בקשר, אני בקשר עם מנהיגים, הצוות הבכיר שלנו, גם של המדענים וגם של אנשי משרד הבריאות ואחרים, הם בקשר כל הזמן עם המקבילים שלהם, אנחנו לומדים אחד מהשני, ואנחנו מנסים כל הזמן להקדים את המחלה ולהקדים גם את העולם. בסך הכל אנחנו עושים.
The number of cases, the number of deaths, and the number of affected countries climbed even higher. WHO has been assessing this outbreak around the clock, and we're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic. Pandemic is not a word to use lightly or carelessly. It's a word that, if misused, can cause unreasonable fear or unjustified acceptance that the fight is over, leading to unnecessary suffering and death. Describing the situation as a pandemic does not change WHO's assessment of the threat posed by the virus. It doesn't change what WHO is doing, and it doesn't change what countries should do. We have never before seen a pandemic sparked by a coronavirus. This is the first pandemic caused by a coronavirus. And we have never before seen a pandemic that can be controlled at the same time. WHO has been in full response mode since we were notified of the first cases. And we have called every day for countries to take urgent and aggressive action. We have rung the alarm bell loud and clear.